Colonoscopy is a screening test, and the point of a screening test is to perform it before you have any symptoms. If we do a colonoscopy before you have symptoms, then we can find polyps and early cancers and treat them so they're not dangerous to you. Colonoscopy is a procedure to detect abnormal growths in the colon and rectum. Those growths can be polyps or even cancer. Colonoscopy is safe, effective, and sometimes life-saving when we detect polyps or early cancers. With time, a polyp can turn into a cancer, and that's why it's so important to have a colonoscopy and have those polyps removed. Colonoscopy is usually recommended at the age of 50, but certain people will need screening earlier due to a family history of colon and rectal polyps or colon cancer. It's best to talk to your doctor about when is the best time to screen for you. Colonoscopy can also be used as a diagnostic test to evaluate symptoms. If you develop symptoms such as rectal bleeding, change in bowel movements, or unexplained weight loss, you may need to have a colonoscopy. In addition, if on laboratory tests your doctor finds that you're anemic, a colonoscopy may be a very important test to perform. In addition, some patients with other conditions such as inflammatory bowel disease will need a more frequent colonoscopy. Colonoscopy is safe. Less than 1% of patients will have any problems after their colonoscopy. Prior to colonoscopy, your doctor will give you a series of instructions to clean out your colon prior to the procedure. These instructions will include dietary modification and special laxatives to help the colon be cleansed. This is very important because during the procedure, the colon must be clean so that the physician can see any polyps or other colon abnormalities. Following the instructions prior to colonoscopy is extremely important to have a good procedure. After your colonoscopy is completed, your doctor will get back to you and let you know when your next colonoscopy should be done. If you have no colon polyps and no family history of colon polyps or colon and rectal cancer, it is likely your doctor will recommend your next colonoscopy in 10 years. If polyps are found during your colonoscopy, your doctor will likely recommend more frequent colonoscopies at 3 or 5 year intervals. Colon cancer is a preventable and treatable disease if caught early. Please talk to your doctor about when you need a colonoscopy. Colon and rectal surgeons are experts in the surgical and non-surgical treatment of diseases of the colon, rectum, and anus. They have completed advanced surgical training in the treatment of these diseases, as well as full general surgical training. Board-certified colon and rectal surgeons complete residencies in general surgery and colon and rectal surgery and pass intensive examinations conducted by the American Board of Surgery and the American Board of Colon and Rectal Surgery. They are well versed in the treatment of both benign and malignant diseases of the colon, rectum, and anus, and are able to perform routine screening examinations and surgically treat conditions if indicated to do so.